In particular, in this module, we're going to be looking at cannabis and driving as one of the public health impacts of legalization. So when it comes to cannabis and driving, there have been several systematic and meta-analytic reviews looking at motor vehicle risks. So this paper by Rosenberg and Elvik gathered evidence from 21 studies of driving under the influence of cannabis. And they're looking at self-reported cannabis use as well as THC metabolites and their link to increases in the odds of motor vehicle crashes, finding a 20 to 30% increase in terms of your odds of being in a motor vehicle crash. So those effects are somewhat weaker when you account for alcohol intoxication. And one of the problematic areas here is the fact that people oftentimes are using both together. So the limitation in these studies is that it's oftentimes unclear when exactly cannabis was used. Other factors may also increase accidents among individuals who use cannabis. As I mentioned earlier, alcohol, for example, can be a kind of a confound in these studies. So one thing is pretty clear is when you look at laboratory studies on the acute effects of cannabis, and these studies date back to the 1970s. Typically, they were done in laboratories using a standardized smoking procedure as well as a driving simulator. So when we look at these studies in some, it's pretty clear that THC is linked to changes in driving ability. Now, one important point, going back to the 70s and 80s, is we're talking about low potency cannabis. And occasionally, though, especially the more recent studies, we've had higher potency cannabis. Also, some studies have used synthetic THC or dronabinol, like 10 to 20 milligrams of THC in the form of dronabinol. So this is a quick look at the driving simulator, at least one of the ones that people have used. A very expensive, very fancy driving simulator here. This is outside looking at the machine. This is what it looks like on the inside, and this is what it looks like when you're actually using it. So what did the study show? I already mentioned the sort of conclusion, which is that acute use of cannabis has an impact on driving ability. In particular, there are modest effects of cannabis on visual tracking, weaving side to side, poor signal adherence, greater variability in headway, slower speed, and some general impairment. And here you see so for example, mean headway for the placebo condition, the low dose condition, and the higher dose condition. So as we go up in dose, we begin to see more errors when it comes to driving. So in summary, acute administration of cannabis impairs driving ability, which makes sense as we know it also can impair cognitive function and some other tests. And so this in some ways has important implications for products available in legal dispensaries, although not all those products have been tested with respect to the acute effects of cannabis on driving. So how does all this relate to cannabis-related driving fatalities, and have those levels of fatalities changed since legalization? These are very important questions. So this is looking at cannabis and driving, and what we're looking at here is drivers who tested positive for cannabinoids in the blue line, and drivers with THC levels greater than 5 nanograms. So this could be any amount less than even 5 nanograms. This is basically just people who have greater than 5 nanograms. And this is post-legalization. So you see basically a somewhat modest increase in terms of prevalence of THC in the blood, both in Colorado and Washington. Now, what does that mean exactly? Well, again, it doesn't mean a lot, because having any level, even less than 5 nanograms, basically that could have been, somebody used cannabis 5 days ago, right? And they still have some trace amounts in the blood. Obviously would not be impairing their driving ability. So it's hard to interpret data like these data. Now, there have been more recent studies using control groups, and this now is a higher level of evidence, right? And so what we've seen, especially here, they're really looking at fatalities. So Lane and Hall published a study in 2019 suggesting a slight increase in fatalities right after legalization, but then decreases in fatalities after that first initial period. And their suggestion was maybe it's due to an increase in naive users right after legalization. So people who basically maybe weren't using cannabis before, started using it after legalization, they're naive to the effects, and basically, that was a problem for them. The fascinating thing, though, they saw the same pattern of effects in neighboring states. And so these were the control states. And so it turns out maybe they're actually, good controls, but maybe they're not good controls because, of course, people in Nebraska and Kansas may be coming across the border to get cannabis in legalized Colorado. So maybe they're not such great, for example, controls. So unclear how that works. However, another author looked at the same or similar data 3 years after legalization and found no difference between Colorado and Washington and neighboring states, and no difference between Colorado and Washington and control states and fatalities. And so the upshot here is that the most recent and well-controlled studies do not suggest an association between fatalities and cannabis legalization. There's this one, again, blip immediately after legalization, but for the most part, in totality, looking at these studies, they do not suggest an association between legalization and fatalities. So what about other forms of harm? What about physical harm or even dying from cannabis? Well, instances of death directly linked to cannabis, these are very rare. There's no known cases of somebody overdosing on cannabis. However, if we look at phone calls to U.S. poison centers involving a single substance, there was 2 cases in 2012 where there was cannabis and a death, and there was 1 case in 2014 where there was cannabis and a death. Unclear if cannabis was a contributing factor in those cases. What about pediatric harm? And I think this is very important. After Colorado legalized, there was an uptick in pediatric cannabis-related calls to poison control. Those calls increased from 0.9 to 2.3 per 1,000. The most common symptoms in pediatric cases of accidental exposure, there were cardiovascular symptoms, there were respiratory symptoms, lethargy, dizziness. So taken together, the National Academy of Sciences concluded that among pediatric cases, there is moderate evidence of an association between cannabis use and an increased risk of overdose injuries. Again, it does seem to be the case that there is an uptick in terms of kids somehow getting a hold of products, especially edible products. Here's another potential harm to pets. Similarly, if we look at veterinary cases of likely / accidental ingestion of cannabis, what we see is similar problems that we're seeing in the pediatric population: lethargy, respiratory problems, dizziness. And there actually is 2 suggestions, basically 2 cases of 125 where there was a suggestion that the animal died due to ingestion of butter from medical grade products. So in animals, there just seemed to be the possibility it can be deadly. This is the paper down here looking at trends in marijuana toxicosis in dogs living in a state with legalized medical marijuana. Okay, what about prenatal exposure? Another very important concern. This is a paper published in Preventive Medicine. Smoking cannabis during pregnancy was associated with a lower birth weight in the National Academy's report. The data are really not clear on other outcomes yet. So until more data are collected, people should assume it's not safe to be using cannabis while pregnant. And again, it makes sense to take the conservative assumption there, even though there's not a lot of data yet. What about exposure via breastfeeding? This has also been a concern of people. The National Academy of Sciences did not identify any good or fair quality reviews of this literature. One issue is that there are a lot of confounds in terms of maternal cannabis use, including the accuracy of self-reports. People oftentimes do not report accurately their use of cannabis. In fact, a lot of people underreport or deny use. So thus far, studies have yet to document a clear link between cannabis use and breastfeeding mothers, and things like motor function and development or physical growth. However, there has been some suggestion that that is possible. And again, it makes sense that until we know exactly what the risks are, why take the risk, right? Breastfeeding, cannabis use probably do not go or should not go together until we know more about the risks. So in conclusion, driving while high increases odds of being an accident. There is no doubt about that. Lots of very clear experimental evidence showing that acutely cannabis can lead to a negative impact on driving skills. However, putting this in context, the effect of cannabis on driving is far less than the effect of alcohol or texting, and pretty consistent with other drugs. So, for example, cannabis might increase risk somewhere in the neighborhood of 1.5 to 2 times in terms of being in an accident. However, that's pretty similar to the effect of benzodiazepines and opioids, right? Whereas alcohol is more like 8 times, and texting even more than that. So the message should be clear. It's dangerous to yourself. It's dangerous to others to drive when you're acutely intoxicated with cannabis. When it comes to fatalities, there's no clear data suggesting that fatalities are increasing as a result of cannabis legalization. No evidence that overdose of cannabis can cause death, but it is linked with hospital admissions. This is very important. A lot of people have had some very negative, scary experiences because they used too much of an edible, and of course, we'll talk about it in a second. But basically, edibles can be misused in a way that leads to a hospital admission, and this notion that is publicized on billboards in Colorado, and we'll talk even more about it in a few minutes in a future lecture. The notion of start low and go slow, that's a very important public health message. Start low and go slow. That is the way to avoid ending up in a hospital or having a very bad experience. Another important harm here is accidental ingestion by children and pets. This is a problem that's been linked with hospital admissions, and it's very clear that we have to keep these products away from children and pets to avoid the potential harm there. Thus far, literature suggests no link between cannabis use and negative outcomes in terms of breastfeeding, but that may just be because the research is difficult to do. Nobody should assume it's safe. There's no reason to take that risk.